Today, we are going to talk about swallowing, specifically how we actually swallow. For dysphagia, I want you to think about it in phases: the oral phase, the pharyngeal phase, the pharyngoesophageal phase, and the esophageal phase. Let's start with the oral phase. If a patient has messy chewing, pocketing in the cheeks, drooling, difficulty forming a bolus, the problem is usually oral. Think problems with the tongue, problems with the lips, problems with jaw weakness, poor dentition, or cognitive or behavioral feeding issues. Next, let's talk about the oropharyngeal, or tongue and throat, and the pharyngeal phase of the swallow. This part of the swallow is the airway protective phase. Essentially, you're going to see coughing, choking during or immediately after the swallow, a wet or a gurgly voice, a delay in swallow initiation, or you might see visible residue in the throat or someone is coughing up residue. These types of difficulties typically point to a pharyngeal problem. That could be reduced hyolaryngeal elevation, a delayed swallow trigger, poor pharyngeal constriction, or reduced glottal closure. These signs should trigger an SLP evaluation or general SLP involvement and typically trigger instrumentation, either with FEES, a fiber optic endoscopic evaluation of swallowing, or a video fluoroscopic swallow study / modified barium swallow study. Instrumentation is important so we don't miss those physiologic changes. Finally, let's talk about the pharyngoesophageal, or throat to stomach tube, and esophageal, stomach tube phases of the swallow. Typical complaints you see here are sensations of food sticking after the swallow, or sometimes a globus sensation, discomfort generally, or reflux-related symptoms. These symptoms often suggest an esophageal pathology. Maybe that's constriction or strictures, motility issues, reflux issues, things like that. These types of issues typically should trigger a GI or ENT workup in addition to that SLP involvement. Something that's important to remember is to ask the person you're working with questions. For example, ask timing questions. Do you cough when you start to swallow, or do you cough because it feels stuck later? That simple difference can really tell you what specialty you may need to loop in. Additionally, document exactly what you gave: consistency, volume, when the cough happened. Was it immediate? Was it delayed? Pre, intra, or post swallow? Talk about the voice quality after the swallow. Was it wet, gurgly? Did they have shortness of breath? That's really important for being able to manage and understand what's going on with that person.